Hello everyone and welcome to our video on healthcare for those with serious mental illness. This will be the first of two videos in this module. My name is Colleen Wong and I'm excited to get started. Okay, these are our objectives for this learning module. By the end of this module, learners will be able to define mental illness and serious mental illness, describe the basic demographics of psychiatric disorders in the United States, explain the major barriers to accessing healthcare for individuals with serious mental illness, identify the medical comorbidities that those with serious mental illness have an increased risk for, and apply techniques to find mental health services and primary care services for patients in your local area. This last objective will be the focus of the second video in our series, where we'll walk through the steps to find services for patients. So, what is mental illness? The National Alliance of Mental Health defines mental illness as a condition that affects a person's thinking, feeling, behavior, or mood. So examples of mental illness include depression, anxiety, eating disorders, ADHD, PTSD, among many others. We use the DSM-5 to make diagnoses, and these diagnoses are usually made by psychiatrists. However, more and more so, primary care providers are the ones making these diagnoses and treating these disorders. Historically, this hasn't always been the case, but as we will talk about, people really need this help, and so primary care providers are stepping up to the plate. Additionally, it's important to mention that there's a wide spectrum of function and dysfunction in terms of how people are able to manage their mental health disorders. A subset of mental illnesses are classified as serious mental illness. As defined by the National Institute of Mental Health, serious mental illness is a mental, behavioral, or emotional disorder resulting in serious functional impairment. And this impairment substantially interferes with one or more major life activities. So the most common conditions classified as serious mental illness are schizophrenia, bipolar disorder, major depressive disorder, and post-traumatic stress disorder. Here are some national statistics on mental illness. It's important to note that mental illnesses are common. More than 50% of Americans will be diagnosed with a mental illness or disorder at some point in their lifetime. In the year 2019, 20.6% of adults in the US had a mental illness, and about 5.2% had a serious mental illness. The prevalence of having either any mental illness or serious mental illness are higher among females, young adults, and those reporting 2 or more races. 41.3% of Americans who needed mental health services did not receive treatment because they could not afford it. So here in the US, health insurance is not guaranteed. And even if you do have health insurance, whether or not they cover the treatments you need is not guaranteed. So this contributes to the huge undertreatment of mental health issues in those who need it. There are hundreds of reasons why someone may seek the help of a mental health professional, ranging from marriage counseling to wanting to work on personal skills, to anxiety and depression, to substance use disorders, and to schizophrenia and bipolar disorder. So, who is part of the healthcare team? Most importantly, we have the primary care provider. They're the ones who oftentimes realizes that someone needs help and refers them to psych. If someone is unable or unwilling to see a psychiatrist, many PCPs prescribe mental illness medications themselves, although this really varies based on the provider. Obviously, the best case scenario would be to have a psychiatrist and or a psychologist on the team. A social worker is important to help identify the resources a patient needs in order to function in their day-to-day life and to stay healthy. They work on things like getting a job, maintaining housing, and finding community resources that can help manage the mental health disorder. Some nurses get specialized training in behavioral health and mental health disorders, so they are very important parts of the healthcare team. There are many community-based groups that provide support and give other people's perspectives on the issue at hand. So examples include Alcoholics Anonymous, and there are also support groups for almost any and all mental health disorders. There can also be many other professionals not listed on the screen that may play a role in managing a patient's mental illness. There are quite a few treatment options for patients with mental illness and serious mental illness. And treatment may look different based on the disorder, severity of illness, individual preferences, and other factors. So, when we say treatment, we often think of medications. There are many medications for the different mental illnesses. Finding a balance of dosage and which specific medication in the medication class takes a lot of time. And some medications take 6 to 8 weeks for the medication to take their full effect. So often a patient will be taking a medication every day and not feel any better or even notice a difference. And so this is something that we talk about with the patients. Therapy is another option. Some examples are psychotherapy, CBT, among many others. And therapy can really look different for different patients. So it can be group therapy, traditional talk therapy with a psychiatrist. It can also even be art or music therapy. Like we mentioned, support groups can be beneficial for patients as well. There are many community-based support groups that help connect people who are facing similar challenges. Psychiatric care can be outpatient, outpatient intensive, or inpatient. Inpatient care is the most intensive and it's provided at a hospital where the patient stays for days, weeks, or months, depending on the facility, diagnosis, and how the patient's doing. Outpatient care can vary as well from a visit every few months or multiple visits a week. And again, this depends on many factors. Lastly, there's acute emergency care, and this is typically a patient who is currently experiencing mental health symptoms such as psychosis, or another common reason for emergency mental health care is attempted suicide. What does this mean for healthcare? There is a large need for mental health services, and the need for treatment is expected to rise as the number of psychiatrists falls. A lot of psychiatrists are retiring or expected to retire soon. There's currently a 6.4% shortage in psychiatrists, and by 2025, it's estimated to grow to 12%. And currently, 77% of US counties have a severe shortage of psychiatrists and other behavioral health providers. For many reasons, but at least in part due to this unmet need that we discussed, those with serious mental illness have higher rates of social vulnerabilities and medical comorbidities. People with serious mental illness die, on average, 25 years earlier than the general population. Although the causes of this premature death are multifactorial, they are at least in part due to the lack of screening and treatment of preventable diseases. As a whole, those with serious mental illness have higher rates of social vulnerability, such as homelessness, violence, incarceration, and poverty. There are also higher rates of smoking, alcohol, and illicit drug use. There's an increased risk of infections and bloodborne diseases such as HIV and hepatitis C. Additionally, there are worse outcomes for common diseases such as hypertension, type 2 diabetes, heart disease, and respiratory diseases such as COPD and asthma. These medical conditions are associated with modifiable risk factors such as smoking, obesity, and substance use, and inadequate access to medical care. So, what are some barriers that prevent patients from getting the help that they need? Like we touched on in the last slide, those with serious mental illness have increased rates of homelessness, incarceration, and poverty. And it's pretty easy to see how these would impede a person from getting the help that they need. A few slides back, we also discussed that there's a growing need for mental health services, and this barrier is compounded by insurance coverage or lack thereof and financial issues. So a lot of patients with serious mental illness don't have a psychiatrist or even a primary care provider. Stigma, both their own stigma and their view on mental illness, as well as the fear of stigma from others. Fear. So what will treatment look like? What if nothing helps? What if my life is different in 6 months? What will my life look like in 6 months or a few years? These fears can be a real barrier to care. Adherence, so continue to take medications long term, going to medical appointments or therapy appointments, and making it to the support groups. These aspects of adherence can be difficult for any patient, but they're made more difficult with serious mental illness. here are some more specifics on barriers to psychiatric service. In terms of insurance, 40% of psychiatrists only take private insurance. So this doesn't include those with state insurance or those who do not have insurance. History of incarceration. Within 3 years of release, 37% of inmates with serious mental illness will be reincarcerated. And 20 to 25% of the homeless population has a diagnosed mental illness. So there are a lot of disparities in healthcare access for those with psychiatric diagnosis, and specifically those with serious mental illness. So here are our take-home messages. Mental illness is common, and serious mental illness puts those affected at risk for other comorbidities. The U.S. needs mental health services. There is a shortage of providers, but there are many community resources available. A lack of insurance or inadequate coverage is still a barrier to receiving adequate services. And so the idea is to take advantage of what does exist and work towards making the system better. And that concludes our video on healthcare for those with serious mental illnesses. Thank you.